Hello everyone, thanks for tuning in to our COVID-19 stats video for the CDC week 46. My name is Sara, epidemiologist at the Jefferson County Health Department. This report includes data from Sunday, November 8th to Saturday, November 14th. As always, we start off with an overview of the weekly total COVID-19 surveillance report, which includes our community-based cases as well as those long-term care facility cases. Unfortunately, we are still experiencing quite an increase in cases. Last week, we had a total of 1,497 confirmed and probable COVID-19 cases in Jefferson County. Our year-to-date total is 9,119 cases as of Saturday, November 14th. We are reporting 94 COVID-19 associated deaths as of week 46 and 23 outbreaks in the long-term care facilities. Before we begin to dive into the specific numbers for week 46, I know there's a little bit of confusion surrounding influenza cases and COVID cases. We do have a separate report detailing our current influenza cases for the season so far, and that can be found on our website. Yes, both influenza and COVID-19 are viral illnesses, but their diagnostic tests are made to detect genetic material that is specific to each virus. So you cannot detect the flu from a COVID test, and you cannot detect COVID from a flu test. We have different reporting and tracking processes for each disease. So rest assured, none of the flu cases we have experienced so far are getting mistaken for COVID-19 cases. We are at the very beginning of the flu season, and previous year's data show that cases in our county generally don't start increasing that much until December or January, just depending on the year. So I would say that we still have another month or two before we can really determine what the flu season might look like for our county. The increase in COVID-19 cases has nothing to do with the flu, and it most definitely is an indication that we have uncontrolled spread of COVID-19 in our county. That being said, let's start with the number of confirmed and probable cases by week in Table 1. Looking down at the bottom of our table, you'll see the total for week 46. As I previously said, 1,497 cases for the week is the highest total that we've seen so far since the beginning of the COVID-19 pandemic. As a reminder, this count does include both our PCR lab confirmed cases as well as our probable cases. Per CDC guidance, those who receive a positive result from an antigen test are classified as a probable. An antigen test is a type of rapid diagnostic testing that you may have heard more about recently. Because those individuals who receive a positive antigen test result are not included in the lab confirmed count, that means they are also not included in that positivity rate. So taking all this into consideration, it is especially important not to write off those probables because of this reason. In Figure 1, we see the confirmed and probable cases by week in bar graph form. Once again, you see the past week's total, which is much higher than any other week we've reported so far. Please keep all of these numbers into consideration, especially as you are making your holiday plans. The next chart shows a current breakdown of the daily case numbers and the 7-day rolling average of cases. The actual number of cases per day is seen as indicated by that dotted blue line, and the solid blue line is the 7-day rolling average. Every day this past week, we had over 100 cases per day, and we even reached another unfortunate milestone, that being a 300 plus case day on the 13th. The 7-day rolling average of cases is one of the main indicators that is used for the color guidance chart for our county, and because of continual increase in daily cases, our status remains to be red. Next, let's look at the overall age group data in Figure 4. For the first time in a while, the 20 to 29 year age group no longer holds the highest number of cumulative cases. The 40 to 49 year age group has the highest number of cumulative cases at 1,000 466. And it was actually the 0 to 9-year age group that experienced the highest percent increase in total cases last week. That age group had a 26.72% increase in total cases from week 45 to week 46. In figure 5, we will be looking at the fatalities and the fatality rate by age group. There are 94 reported deaths in our county, most of which have been in the 80-plus age group. But we are unfortunately seeing more 60 and 70-year-olds passing from this disease. We are now updating the fatality count each Wednesday, so you can find that updated information on our website and on our social media accounts. Our cumulative fatality rate in Jefferson County is 1.03%. Missouri's fatality rate is 1.39%, and the fatality rate for the U.S. is 2.26%. These rates are continuing to get lower, which is encouraging because that does mean better patient care, but mortality is not the only measure of severity. We should care about all the different rates, the case rates, the hospitalization rates, the recovery rates, and the death rates. They're all important. Moving on to figure 7, we have the COVID-19 PCR test results by week, as well as a visual of that percent positive rate. This data only includes those lab confirmed PCR cases. So remember that this does not include the probables, the antibody positive tests, or the antigen positive tests. The percent positive is currently sitting at 36.6%, which is much higher than we've seen, as indicated by that very steep increase in that dark blue dashed line. Table 3 is where we can see the actual values of those positive tests, the negative tests, and that weekly percent positive rate. During week 46, we had 1,367 lab confirmed positive cases. But I want us to look back to week 45 for a moment. As I always say, that percent positive number will likely change over the course of the next week or so as we continue to get those negative results in from the state. But when we look back at the week 45 number, now that the negative count has stabilized for that week, the percent positive is still very high. Our testing has not increased in nearly as much as our positive cases, even though I expect us to receive some more negative results in for week 46, our percent positive is still going to remain much higher than we've ever seen. For the zip code data this week, we can see the cumulative number of cases in each area shown in blue, as well as the active cases in each area shown in orange. The active cases are those new and recent cases that are currently under investigation and in the process of completing their isolation or quarantine period. The Arnold Area 63010 has both the highest number of cumulative cases as well as active cases for our county. For the last piece of our main weekly surveillance report, we will look at our cases by zip code per 10,000 residents. The rate per 10,000 takes the population of each individual zip code into account. So this helps give a better comparison, especially for those areas with larger populations. Herculaneum 63048 is that area there that you see with the highest rate per 10,000. But you can also see that many of our other areas have very similar rates, right around the 300s and the 400s. Moving on to the current school-aged population data. As of week 46, there have been a total of 1,283 lab confirmed and probable cases in the 0 to 19-year age group for Jefferson County. In figure 1, we see the number of confirmed and probable COVID-19 cases by week for the 0 to 19-year age group. During week 46, there were 237 cases reported for the 0 to 19-year-olds, which is the highest weekly total that we've seen so far for this age group. In figure 2, we have the cumulative cases and the active cases by zip code for our 0 to 19-year age group. Let's again focus on those orange active cases, so the cases that have not yet been released from isolation or quarantine. Arnold and Imperial both have over 50 active cases within the 0 to 19-year-olds right now. So please take extra caution and help our children learn the importance of good hygiene, masks, social distancing. Right now, we are seeing more cases than ever in our youth. And while the majority of them tend to have milder cases, they can most definitely spread the virus to our vulnerable populations. When we look at figure 8, we see the 7-day rolling average of cases for each of the age-based grade levels. So we've divided up the 0 to 19-year age group to reflect the average ages in each grade level: pre-K, elementary school, middle school, high school. The high school aged students are shown there in yellow and have the highest amount of daily cases when we use that 7-day rolling average of cases. But each of the other age groups are also showing increases in the 7-day rolling average of cases. Their trend lines are all moving upward toward the right-hand side of our graph. And lastly, let's review the weekly community-based surveillance report, which excludes the long-term care facility cases. In figure 1, we see that the weekly case count, excluding the long-term care facility cases, during week 46, 1,434 cases were community-based cases, which means that 63 of our cases this past week were found in those long-term care facilities. Those cases do come from both the residents and the staff of those facilities. When we look back at the age group data for our community-based cases during week 46, we can see that the majority of our community-based cases are coming from 4 of our 9 age groups. So those ranging age 20 to 59, the 4 age groups right there in the middle, they have a higher number of cumulative cases, and they also have a higher rate per 10,000, more so than the rest of our other age groups. Figure 5 shows the fatalities and the fatality rate by age group for our community-based cases, excluding the long-term care facilities. 39 of the 94 deaths in our community were community-based, and this puts the fatality rate for Jefferson County, excluding long-term care facilities, at 0.47%. Before we finish our report for this evening, I would like to encourage everyone to follow along with the St. Louis Pandemic Task Force for information regarding our local hospital systems. Jefferson County residents are included in their reports, and right now it is extremely important to understand what is happening in our surrounding area hospital systems at the moment. If our hospital systems become too overwhelmed with COVID-19 cases, there may not be enough resources to treat the many, many other diseases that normally fill the hospitals. Let's all please work together to get the cases down, not only for ourselves, for our family members, but also for our hospital staff as well. Once again, thank you all for listening and watching our staff's report this evening. Please be sure to refer back to our website, jeffcohealth.org, for more details and recommendations on COVID-19. Leave us any questions that you may have in the comments or reach out to us via direct message. Have a safe and healthy rest of the week and have a great night.